All right, welcome to the Dr. Sorin Show. I'm super excited about our guest today. We have Magda Ciocazan, and Magda is a public health professional. She has her master's in public health. She's also a massage therapist and lifestyle coach, specializing in chronic disease prevention and health promotion. Among others, her career includes services at the prevention services with the CDC, Center for Disease Control and Prevention, and she's also founder and runs Magda's Medical Massage and Wellness in Bonners Ferry, Idaho. Magda, thank you so much for joining me.
Thank you for having me on your show today.
Okay, perfect. Awesome.
Yes.
So,
can you hear me all right?
Yeah, I can hear you perfect. All right, just making sure all the technology works. But Magda, again, thank you. Just clarify your background. You've actually got a master's in public health, correct? Just briefly give me your background, your education.
Yes, I have an undergraduate in microbiology and nutrition, and then my master's studies are in public health and chronic disease prevention especially, and I've done some work in infectious disease.
Okay, awesome. So I know you worked at the CDC.
Right now I'm
all right. So there's just a little bit of a delay, so sorry about that. We're doing this over Zoom. So, and we're going to be posting it on the drsorin.com and our YouTube channel, The Dr. Sorin Show. So Magda, let's just jump right into it. Today, it's all over TV. Everybody's talking about coronavirus. A lot of people are really scared. And, I'm pretty passionate about this. And I think the key to this for everybody should be focusing on, of course, is avoiding the coronavirus. But more importantly, and this goes for the seasonal flu because we're heading into the regular flu season, is maintaining a strong immune system. So I think they both kind of have the same cure, because who knows, you can do everything perfect, but who knows how you're going to get exposed to it. And so to me, the key to this whole thing is just maintaining a super strong immune system. So that's what I want to focus our show today. I know you've got a lot of information on that. I just want to make one other comment too. Our healthcare system in America is fantastic for treating you once you're in the ICU and once you have to be intubated and all that. Our health system is very good at that, but our health system is not very good at the prevention, at the stuff you can do at home. So that's one of my areas of passion. I know it's one of the areas that you're really excited about. And so I'm really eager to hear kind of some of what I know you were born in Romania, but you've also trained in, was it Denmark? And you've worked at the CDC and you got your master's. So
Netherlands.
Netherlands, that's right. So I know you've trained abroad. So kind of bringing in the European, their wisdom and kind of mixing it with conventional medicine. So let's just jump right in. So
yes, and that's exactly kind of what I wanted to focus on as well. In fact, you and I are going to do a seminar. It's called Prevent and Fight Disease in Times of COVID. And that will be offered in December, on December 6th. It's a Sunday at 2 o'clock. It will be a couple hours. And we will talk about practical applications, practical things that people can do at home to, prevent, fight, the flu, also any disease, and COVID, things like that. Basically, the most important, the key, we're going to share a lot of resources, and it will help in both the prevention phase and the second phase in fighting infection. But the most important thing that we really want to highlight, like you said, is how to strengthen our immune system so that it will recognize the infectious agent. You see what happens with coronavirus, with SARS-CoV-2, is that it kind of hides, if you will, from the immune system. And it's not until it gets into the lungs and it creates this, what is called the cytokine storm, that the immune system just goes crazy and wants to attack it. And it really, some people even call it, it's almost like an autoimmune disease. You're almost starting to attack yourself. So we want to prevent this from going to the lungs and from going further into just, your upper respiratory system. And the best way to do that is for the immune system to be strengthened, to boost it up, so that it can recognize it, that there's an invader there. We need to take care of this right away. So that's our biggest challenge. And actually,
Yes.
there are ways to do that.
Yes. And unlike your typical viral flu, what you're saying is this causes a cytokine storm, which your immune system kind of gets over revved and almost starts attacking your own body, and that's where we're seeing a lot of the deaths. And initially they were treating those with just by putting people on ventilators and kind of the traditional model, but they found that some of these immunosuppressant drugs, like even dexamethasone, and for a while they talked about hydrochloroquine, but either way, some of these drugs that suppress the immune system can actually help. But let's talk about, and let's just jump right into it. Let's talk about ways that you can do it. And again, this is going to be stuff that people can do at home. And I do appreciate you mentioning the class. Again, that's on December 6th in Sandpoint, Idaho at 3 p.m. And what was the location?
It's at 2 p.m. It will be at the
2
Sandpoint
p.m.
Seventh-day Adventist Church Fellowship Hall.
Okay.
Yes.
So there.
And we'll mention that at the end as well.
Very good, Magda. So let's just jump right into it. Let's talk about, I think we're going to have several categories of things we can do. So let's just start with the basic preventative measures. I know a lot of people know these, but I think it's still a really, really good review. So let's go through it.
Sure. Yeah, we know about hand washing. It's been at the forefront of all of our instructions wherever we go. But maybe you may not realize that the key is not just in the fancy sanitizers or in the antibacterial soaps. It's actually in the rubbing motion that we do. It's lathering with the soap, just normal soap. But the friction rubbing motion for 20, 30 seconds and then washing with clean running water. Remember, like, the virtue of rubbing alcohol is not in the alcohol, it's in the rubbing part. And so it's the same with soaps. And so that's why it's recommended 20, 30 minutes of lathering and rubbing and friction.
20, 30 seconds.
Then avoiding touching our, I do it for a little longer. I recommend it for a little longer, but then some people might say, are you getting ready for surgery? So,
okay.
Avoiding touching your eyes, nose, mouth. We know those things. Covering your mouth and your nose with disposable tissue. Staying at home if you have symptoms. I think the biggest thing that, we've run into the past few months is that everybody's being isolated. But we know that the most important thing is we need to isolate ourselves when we have symptoms. So remember that. And also educating ourselves, keeping abreast of developments. They call it a novel virus because it is a composition of different viruses. And so we are learning new things about how it acts in the body, how our body acts to it. And so it's important to educate ourselves.
Hey, let me just throw in a few things. Can I just throw in a few things? This is, so the incubation period, and just kind of going along with that, the incubation period is usually within 14 days of exposure, but most people get the symptoms within about 4 to 5 days. And so it looks like in this study of 1,100 people, incubation period on average was 4 days, ranging from 2 to 7 days. And the initial presentation, I think this is important. So how do you know if you have the flu or if you have coronavirus? So again, from up to date, they're saying cough in about 50% of people, fever in 43%, and again, a fever is defined as greater than 100.4, so 100.4 degrees Fahrenheit. Myalgia, which just means muscle ache, about 36% of people have that. Headache in 34% of people. So again, about a third get the muscle aches, the headaches. Dyspnea, short of breath, 29%. Sore throat, 20%. And even diarrhea, 19%. But now, and then nausea, vomiting, 12%. And then loss of smell or taste, abdominal pain, runny nose is less than 10%. So those are some of the symptoms, and those are very, very similar really to the normal
Yes,
flu.
except for the last one. And the last one is very telling, you know, if you lose your sense of smell and taste. And on the CDC website, they say this is how you can differentiate between the two. And you don't lose it right away. You lose it after a week or after 2 weeks. So most people have experienced these. So about, you know, several days you're sick, you feel like you need to be in bed, and you should be. Then they have this weakness that just continues on for a week.
So you were talking the loss of smell is kind of distinguishes it from the usual flu, correct?
And then I was also explaining that there's a weakness. It really attacks like the whole body, and you have this weakness that just carries on with you for a week or two. And so it's important to kind of take it easy a little bit and rest. And we'll go through some of that as we carry on in our discussion here. But
Okay. Yeah, go ahead. Just pick up where you left off on those basic preventive measures.
Yeah, and I think in the prevention phase, you know, there are basically a phase where people don't really have, you know, a lot of symptoms and such. But to kind of prevent things from getting worse, there are some things that we can keep in mind. And this works for all infections, but especially for this one. Maintaining a good attitude. I have a little acronym that I'm borrowing from somebody, and they call it MEET MARK. MEET-MARK, and each of these stands for something. Maintain a good attitude. You know, our thoughts, whether positive or negative, really have a direct effect on our immune system. So those who are happy, cheerful.
Right, and I think that's something I've said that before in this show, but that's something I think in the West we underestimate the power of your mind and how that relates to disease. So I think that's huge. So I think people that are just generally happy and positive and have a good outlook will do better than somebody who's just, you know, kind of got a rainy cloud over themselves all the time.
That's right. That's right. And, you know, and people can actually learn more about that. Like you said, we're not really too much into it all the time. There's a seminar called The Law of Life that you've had on your show before. And they can go to lawof.life, lawof.life. And on that website, they can find more information and videos. But along with that, exercising regularly, being active, like shoveling snow, park further away at the grocery store, walk as much as you possibly.
So you were saying exercise regularly. I think there's a ton of data that shows exercising regularly, getting that blood flow really boosts your immune system. So, and having that level of fitness, no matter what age you are, before you get the virus is going to be protective against the virus, correct?
Right, exactly. Being active. You know, not everybody can or should have a gym membership, but being active in all kinds of ways around us, yeah.
Mm-hmm. Okay, so we talked
Also,
about the first
eating,
is maintain a good attitude, exercise regularly. What's the third one?
eat an immune promoting diet. So whole foods with lots of antioxidants, fruits, vegetables, legumes, whole grains, nuts and seeds, and also avoiding processed carbohydrates, sweeteners, artificial foods, fried foods, animal products. And remember that COVID-19 virus was 89% nucleotide identified from bats, SARS-like CoV-ZXC21. So it's thought to have come from bats and other high-fat foods.
So you mean it didn't come from broccoli? I'm just teasing here. So
The daily contrast showers.
Mm-hmm. Okay, so we talked about maintain good attitude, exercise regularly, eat a immune promoting diet. So the T is take daily contrast showers. Now describe that to us.
Yes. So our goal in this conversation is to increase our immune system. What SARS-CoV-2 kind of likes to hide itself from our immune system until it gets into the lungs, and then it just creates havoc. So what we want to do is heighten our immune system so that when an invader like this comes, your immune system fighters are out there looking for intruders. And so a contrast shower is alternating between hot and cold, beginning with hot and ending with cold. So you take a shower, you start off with hot for, let's say, 3 minutes, and then you just go around the shower, have all parts of your body kind of, be hit by that hot water. And then you turn that to cold. And remember, the key is contrast. So you want to turn it as cold as you can handle for about 30 seconds. And again, deep breath, run around your shower, turn it back to hot as you can handle. Do this about 3 to 5 times. Your immune system doesn't kick in until you've done it at least 3 times. So what
me
it
doing
does,
it just once, me doing it once is not good enough. I'm pretty proud of myself when I do it once. So I've been doing it wrong.
That's great for just a regular shower. It's not good. It's not good for that. That's great for your skin and stuff, but it's not good for the immune, not sufficient for the immune system.
So you got to do it 3 to 5 times.
Yes. 3 times is good enough.
It's very interesting because a lot of these guys, even Tony Robbins and some of these guys, they all do this cold and they immerse themselves in cold water. So, and, I mentioned your training in Europe, part of it, but I know in the Nordic countries, this, it's a big deal. People have these little sauna things and then they jump in the ice cold water and then they jump back in. So even a lot of the Asian countries, that's a very common thing to do.
Yes, and they have shown that people who do it at least 4 times a week don't have, the influenza or the disease or different things like that. So the immune system is heightened. So doing it 4 or 5 times a week, it would bring that up. Yeah. Mm-hmm.
All right. Well, that's a good one that everybody can shoot for. And especially, I know this, some people drink coffee. I don't drink coffee, but if you do this contrast shower, you won't need any coffee because you will be wide awake.
Exactly. That's right. That's what I promote also with my clients is, if they want to get off the coffee and they realize the harmful effects, this is what I recommend for them. That's right.
All right.
The
so I love it.
next letter is M. So maintain optimum vitamin D levels. Daily sunshine exposure or vitamin D3 supplementation, they really enhance the immune function. So the virus is sensitive to UV light, and that's great. But also we want to let as much sunshine into our space, every space that we occupy. So being out in the sun, taking vitamin D supplements. The key to this is not to just increase it when you're sick, is to take it continuously and then increase it when you're sick.
Yeah,
okay.
And I know there's a number of studies that have shown that it's not the one time like boosting, you get sick, so you take a bunch of it. Really what showed to be most effective is if you take it regularly. And I'm just curious, do you have dose recommendations for vitamin D?
People are very conservative. They say, 1,000, during the summer, 2,000 to 5,000 in the winter. And then, but to really, if you get sick, 10,000 is okay, because you're taking it for a short period of time. And so,
yeah. So I think those are very reasonable numbers. And usually I tell people around 5,000 a day in the winter. And then certainly you could reduce it. And then you can always have talk to your doctor and check a blood level. So then you can be very scientific and know if you're overdoing it, because you can't overdo vitamin D, but I think you have to take a fair bit to really overdo that one.
and for a longer period of time.
Hmm.
The A then in our acronym is Anti-Infectious Herbs and Supplements. This is a list that people can start writing down and just have on hand. So zinc, when we're in the prevention phase, you want to take about 20 to 25 milligrams a day. When you're in the therapy phase and you're trying to fight something, 75 to 100 milligrams a day, for about a week. And then kind of start tapering down again.
Yeah.
Zinc really, it's almost like it helps on contact, so to, when it's in your, when you start getting the infectious agent, zinc is just there and it just kind of starts diminishing it. Another thing is NAC, N-acetylcysteine. And really was shown to decrease symptoms associated with respiratory disease. And it promotes the production of glutathione, which is an essential amino acid. It's really a prominent antioxidant in the body. And it's really okay in pregnancy and lactation as well, and in children. So cysteine is very good. About 60 milligrams twice daily is very beneficial. Another thing
so
we know.
and yeah, and I just want to promote those two. So those are two things that I highly recommend. So zinc, my understanding is that your body uses zinc to kill the virus. So, that's like having ammo in your gun, so to speak, that's going to shoot and kill the virus. So zinc is super important. And then N-acetylcysteine. So that's also been shown, my understanding, to be effective against just the regular flu. So if you're concerned about that, NAC, your local store, supply store, vitamin store should have that, health food store. So that one is not hard to find.
Right, and that's great to take, but also we have to remember it's found in sunflower seeds, legumes, and so that's cysteine, and so that's, and glutathione as well. So those are also found in foods. So it's great to have a variety of whole food, plant-based choices at home. Another one is vitamin C. We all know about that, and again, like with the vitamin D, you want to kind of keep on it and then increase it if you have symptoms. Another one would be ginseng, echinacea. Those would be some herbs that are helpful. And don't forget probiotics. They help, keep that gut healthy, and helps you fight, like 1 billion CFUs are recommended daily, just on a regular
And then
basis.
on the vitamin C, just out of curiosity, if you've got opinions
How
on
much?
that. I know, yes, how much? They usually come in 1,000. I know Costco sells a little 1,000, and they taste like little candies, so my kids line up to get those.
Right. So you want to get vitamin C with bioflavonoids, and that's one thought. Also, how much? Yeah, for daily prevention, 1,000 is fine. And then as you go on, if you have something, then you want to increase that to bowel tolerance. Some people is 5,000, some people is 10,000, some people is 20,000. So to bowel tolerance.
I didn't know that. I just stick with
The next one is rest. Yeah, you
Which
want
one?
to take more. Our next thing is rest.
Okay.
If there is one thing of all of the lifestyle things that I ever teach, is rest. That is the most important thing. And I know that a lot of times we have so many things going on. Sometimes we're caregivers, and sometimes we have children, and sometimes we're divided into so many different roles in our lives, and rest is the last thing that we think about. but it's actually the most important. It's more important than exercise, more important than diet, it's more important than anything. And especially if you are sick. This is coming from a lifestyle coach. So I used to pound on diet, but I have found that rest is more important than the exercise and the diet, as important as those are.
I totally agree with you. I read a great book by Matthew Walker called Why We Sleep, and that guy just lays out all the data and just shows you sleep, it's related to cancer, even pain management. You look better, that joke about your beauty sleep, it's true. Mm-hmm. Like they did randomized controlled studies where people that sleep better, they just look better, and somebody in a picture can recognize that. So rest is so underappreciated in our society. We're always burning, the fuse at both ends. So
because
totally
you're making healing hormones when you sleep between the hours as 10 and 2. So that's just bottom line. So you want to sleep 7 to 8 hours, 9 hours even, between the hours of 10 and 2 for sure.
And I just want to point this out too, with one thing is kids need more sleep because their brains are still developing. Yes. And kids, even being up to even like 20 years old, need to get that, more like 8 to 9 hours of sleep. And then when they're young, they need more like 10 to 13. Mm-hmm.
12, exactly. Children up to the age of 12 need 12 hours. And they still need some, extra when they're adolescent, for sure. Yeah, good point. And the last in my little acronym, meet Mark, the K, air, fresh. All cases of known COVID-19 transmission happen in confined spaces. And so keeping windows open, constant flow of fresh air in your workspace, in your home, and just spending time outdoors. And we're very fortunate to be able to do that here where we live in northern Idaho. So what do we do in the early therapy phase? That's very important. And we're going to go in detail in our seminar on December 6th on this. If you begin to feel ill in any way, sore throat, headache, body aches, fever, chill, if you want to start some natural treatments, you want to start some things as soon as you have the first symptoms. So your lymph nodes are swollen, you feel kind of a sore throat. Okay, immediately you want to take a contrast shower. Have that vigorous, contrast hot and cold shower. This time, Sorin, is not 3 times. It's 5 to 7 times. So because you really want to get your immune system activated, and you want to make sure that it's ready to just fight whatever intruders we have, and in this case SARS-CoV-2.
So that is just like recruiting your immune system, and you're just setting it on fire by doing this. And
exactly.
Again, I'm just going to say it's the old European way is, when you sweat it out, you get the flu, but it's basically a form of like contrast because they would, I remember my mother and grandmother doing this to me when I was little, but they would like bundle you up and you'd really sweat, and then they'd like take a wet, cold water and rub you down, change your clothes, and repeat the cycle. But I think that hot, cold kind of just stimulates the immune system, and the contrast shower is kind of a natural way of just, turbo boosting your immune system. And by the way, I don't know if you mentioned this yet, but avoiding sugar. There's even videos, you can Google it on YouTube, but natural killer cells. Isn't that a cool name for a cell part of the immune system? But these natural killer cells, when you eat sugar, it basically anesthetizes them. It puts them to sleep. And
yes.
So it's so interesting how flu season kind of coincides with, first you get Halloween, and then, Thanksgiving, and then Christmas, and then New Year's. So we kind of have all these celebrations, and most of them involve a lot of sugar. And so you know, I think that kind of coincides because you're weakening your immune system when you're eating all the sugar. And every store you go, every office you go, they got candy everywhere. And so it just, I mean, it's a fun time of
Right.
the year because of the celebrations, but it's, you know, we really beat up our immune system by eating so much sugar and candy.
Exactly. And this is an opportunity to learn to make some healthy desserts that are, you know, maybe from dried fruit, healthy sugars, healthy carbs that are not refined. Exactly. So that it does not depress your immune system.
That's a really good solution. So there you go. People listening out there, uh, look up, Google, find some great recipes of healthy, you know, limit the processed sugar and more whole foods rather than just pure processed sugar on everything.
Yes. Another thing, so you mentioned like a hot bath. You know, your grandma and mom would give you a hot bath and then will bundle you up so you can sweat. Absolutely. That's what you want to do. You want to take that bath, be in there, sweat it out, change your clothes, change your sheets, and then sleep some more. Remember, every time you do a treatment, you got to sleep for about 20 to 30 minutes. That's just, it has to happen. Take a hot foot bath. A hot foot bath, really what it does is it works by the process of derivation. So it derives the blood and congestion from one area. So let's say you have congestion in the head and chest. It derives that to the feet. And so it takes away the congestion. So it really helps with that, helps the immune system again, because that's what we're looking for. So a hot foot bath, and we're going to go, these treatments have some specific things that we want to look out for, that we want to keep in mind to include. And so we will go through the specifics of the key things that we want to do in our seminar on December 6th.
Yeah, and actually, Magda, go ahead and just give another plug for that. So tell us about this seminar.
Yes, we're going to have a seminar on December 6th, Sunday at 6 o'clock. I'm sorry, December 6th at 2 o'clock at the Sandpoint Seventh-day Adventist Church Fellowship Hall. And the seminar is called Prevent and Fight Disease in Times of COVID, How to Strengthen Your Immune System. And we'll go over these
in detail. And then just, I know you do a lot of this health coaching, so go ahead and just announce your info to Magda's Medical Massage, to your business, if somebody just kind of wants more individualized coaching on some of these topics.
Yes, I teach a lot of hydrotherapy and lifestyle consultation. If people want to, you know, incorporate some of these natural things into their life, either to prevent chronic disease or to reverse chronic disease, things that we can do that are lifestyle related. And I have my practice in Bonners Ferry. It's called Magda's Medical Massage and Wellness. And those who are interested in therapeutic massage, I don't do foo-foo. My teacher would slap us, so I've learned not to. But I'm really interested in helping people if they need deep tissue, therapeutic massage, sports massage, medical massage. I can help somebody who has, you know, some unresolved issues, pain, different things like that, but also with the lifestyle coaching as well. Some of the things that we cover right now today, as well as in the seminar, I can sit down with people and customize some consultations.
And how do they get a hold of you? Do you have a website? Do you have a website?
They can call me. I have a number, 208-907-1517, 208-907-1517. That's my office number. And I'm also on Facebook. It's called Chatting Lifestyle.
And how do you spell chatting?
like chat, ChatTing, chat.
Okay, chatting lifestyle. So, and again, I think that stands for something, right? Community health, something.
Advocacy training, yeah.
Community health advocacy training. I know you did that, and you're big on that. So, anyway, I just want to kind of give a little pause and intro and kind of recommend that. I know you do a lot of this stuff, and if people are interested, they may want the individualized coaching. Or massage, the medical massage. So let's go through that. So you kind of mentioned, you know, when you first get the symptoms, you start feeling icky, you can take a hot shower, you know, 5 to 7 times. So really get your system going. And then you mentioned a hot foot bath.
Contrast shower,
Okay.
hot and cold.
Okay. And then you mentioned a hot foot bath.
Mm-hmm.
What else? What else should you do when the symptoms first start?
You can take Schizandra. It's an herbal decongestant. It's spelled Schizandra. Schizandra.
So
That
that's
helps with
for
decongestion.
okay.
Another herb that's helpful, that's anti-inflammatory, is white willow. So instead of taking like ibuprofen or Tylenol, which actually depresses your immune system, you want to help your immune system with some natural things such as the hydrotherapy that we're going to go over, and we mentioned here, the anti-inflammatory herb. Also ginger is very good. There are other preps out there like Breathe Easy, Throat Coat, these different type of teas that help with different symptoms. In other words, they don't suppress your immune system, they just help your body fight. Well, what we want to do is to help our strongest defense is our immune system, and especially with SARS-CoV-2. We want to support the immune. I talked to an ER doctor last week, and I said, so what do? We have this patient here who has viral pneumonia, not a bacterial pneumonia. We has viral pneumonia. What do we do? And we give him remdesivir. We give him a steroid to prevent the cytokine storm. And we want to support the immune system to fight. Those were his words, Sacred Heart, a doctor there. And so those are some of the things that really we are left with. And that's why I think that this seminar is so important, and the fact that we're out there in the community helping people, you know, get some tools in their hands, get some resources so that they can have this and fight to strengthen the immune system. So these therapies can help cut the progression of symptoms.
Yeah, and let me just throw in a few other things. So this is what I always do. So I try to do the contrast showers. I don't do the 5 to 7 times, but I need to start doing that. But also do everything you mentioned earlier. If I haven't been, take the zinc in more like 50 micrograms, I think, per day, and then vitamin C, and then the NAC, and then quercetin is one that we haven't mentioned, but specifically
Yes.
that's also been shown to be helpful. Quercetin. So those are kind of some of the supplements that I've found to be helpful with this.
Quercetin is found in onion. So eat the raw onion, raw garlic. Garlic is antiviral, anti-inflammatory, anti-bacterial. It helps with blood pressure. It's just good overall. It helps with blood flow. It's just great, garlic. And then that will keep you, that will help you keep your social distance for sure.
That'll force you to have social distancing. So that's right. So no, I'm a big fan. Everybody kind of knows garlic is just super powerful. And it's used a lot in, you know, Mediterranean and European cuisine, Italian cuisine. So, you know, you can enjoy it and take more of a medicinal dose when you start getting sick, and that seems to boost your immune system as well.
Yeah. You know, I think the most important thing is some of the things that I want to mention next. So you have some, persisting symptoms. What do? You want to immediately start resting more. A prominent component of successful treatments of patients, for example, remember the Spanish flu in 1918?
Hmm.
The early initiation of total bed rest was really what showed to be successful. Once individuals start to feel ill, they were isolated, they were put on bed rest, and they were kept there until 2 or 3 days after their fevers resolved, doing with all the things that we have mentioned previously. And then this as being the prominent thing. Then they did the hot and cold applications. Specifically, we're going to talk about fomentations, which are a very specific thing that helps, especially with upper respiratory disease, and helps prevent that pneumonia that's so, scary for people.
Hmm. Hmm.
Um, Definitely want to drink lots of water, lots of herbal teas, lemon juice, fresh green, fresh carrot juices, etc. You mentioned the sweating. That's important. You want your body to sweat out the toxins and everything. And you want to keep your head cool when you're sweating. You can sweat by doing these saunas and different things like that. That's a very good one. Let's say you have congestion.
But I think,
You want
and
to do
just
a
to,
steam.
oh no, go ahead. Just on the sweating, I think part of it is you shower in between, or you at least take a rag and kind of rub yourself down. Plus, that also stimulates blood flow, and then you change your clothes, so you don't want to be icky and sweaty, but you want to.
Exactly.
Mhm. Okay, so let's talk. What else?
You want to do a steam inhalation. You can use eucalyptus, peppermint. You throw in some sea salt. You put a small, kettle of water to boil. Put in some sea salt. Put in some eucalyptus, 5 drops of eucalyptus, 5 drops of peppermint. Put a cover on it. Let the steam kind of lift the cover when you're ready to go over the pot for a second so that you don't get burnt. Put a towel over your head and just inhale that for 15-20 minutes. And that helps open up your pores. It really helps you breathe easier. And
So,
definitely.
and just to clarify again, I always talk about my grandmother who did physical therapy in nursing school in the 30s in France and in Switzerland. These are all things she did for me growing up. So these bring back memories. But you would take a pot and like you're gonna make tea, and you're mentioning you put the tea in there, and then you might do these essential oils in there, like you mentioned eucalyptus. I think eucalyptus has been shown to be effective, and peppermint. They're really help thin out the mucus and eliminate that, even if you have a head cold, something like that. And then you put a towel over your head, and then you let kind of that steam come out from the essential oils, and you breathe that, and it kind of helps break up the mucus and even get into your sinuses and kind of help drain those.
Exactly. And you want to put those after the water boils so that they don't totally evaporate, and you can benefit from inhaling those for sure.
Mm-hmm.
And remember, as symptoms continue to worsen, you want to contact your local healthcare facility, alert them of your situation, and seek the care according to their direction. But sometimes you can't get in, sometimes you can do a video call. So you want to not wait, you want to immediately do some of these things. And, a couple of days pass by, and if you're getting really sick, and if you are a person who's more vulnerable, you definitely want to contact your doctor, because there are some things that they can maybe do so that you don't end up in the hospital, and you can treat this at home and be able to pass through the harder phases. But remember, you want to catch this early, and you want to prevent that cytokine storm that we talked about earlier. So we want to do everything when it's up here before it gets in the lungs. So that's why we're talking about these things.
Yeah.
And really
thank
what
you.
it is your immune system.
Yeah, and thank you for clarifying. Obviously, if you're really sick, you need to go to the hospital, but everything we're talking about is if you're a little bit sick and you're trying to knock it out as fast as possible and not have it turn into something much more serious. Because the good news with COVID is 80% of people don't require any sort of hospitalization. So for 80% of the people, just everything we're talking about can kind of boost your immune system and help you avoid symptoms where you may need to be hospitalized. So that's a great point. All right.
Exactly.
Do you have more for? Yeah, go ahead. Keep going.
I just want to wrap it up. You know, as you recover, you want to continue to rest. Do not start working or working hard or getting back to normal life as usual. 2 or 3 days, you want to continue taking it very easy, because you know, you'll have, it will just throw you down again. So you want to rest. You want to continue the contrast showers. You want to limit the amount of work that you do, spend a lot of time outdoors. And again, keep a cheerful state of mind. The impact of your thoughts and attitude on illness is great. So maintain that cheerful state of mind. And
Love it. Hey, I do want you to mention,
key.
I do want you to mention, you talked to me about nature's penicillin. So this is kind of a natural antibiotic, if you will. And how do you mix that up? Just give us your special potion there. You'd mentioned it to me earlier, nature's penicillin.
Yes, there are a few different recipes, but kind of what to keep in mind is citrus fruits such as orange, or grapefruit. They're helpful. Things that are anti-inflammatory, they have vitamin C. Things that are anti-inflammatory, such as pineapple juice. You know, it has bromelain. Garlic, onion. So what a recipe would be, take a half an orange, half a grapefruit, a lemon, wash everything really well, make sure they're organic, throw them in the blender. Seeds,
with the scanner, do you take
everything.
Everything. Okay.
3 cloves of garlic, half an onion or a shallot, put it in a blender with some little bit of ginger, a little bit of cayenne, a cup of pineapple juice, or you can do less pineapple juice, and 3 drops of peppermint, and drink this throughout the day. It's powerful. Some people call it rocket fuel. Or Russian
I've heard of this rocket fuel.
Whatever the name.
Russian penicillin.
It's potent.
I heard somebody joke saying they like their sore throat better than they like this rocket fuel, right? But it's powerful. But it's still, if
it is.
I think if you want to knock this out and you're trying to avoid, antibiotics, or trying to avoid, needing to go to the doctor and get those things, this is just something you can. Just some natural things you can go buy at your local store that'll really take it to the next level. And I've had these a few times, and boy, oh boy, it's pretty strong, especially if you go a little crazy with the cayenne and the garlic. It can really, but I do like the touch of the grapefruit juice. So maybe that'll kind of sweeten it up and give it a little bit better taste.
Yes, and the pineapple juice, that's right.
Yeah. Well,
yes.
Well, you've given us a tremendous amount of information. And again, one of the things I love about kind of the natural stuff, this is by no means saying, if you're really sick, don't go to the ER, but how much better would it be to avoid going to the ER and do some of these things, naturally treat them at home and really keep your immune system strong so you can avoid COVID. So and then even, avoid the the flu, or at least minimize your risk of getting the flu. So I just kind of want to cover the kind of the natural aspect of this, because I think it's an area that's oftentimes neglected. You know, we're good at, you know, the healthcare system, you know, wants to give you the vaccines and the antibiotics and all those things, and that's all fine. But I think your best first line of fighting is to you know, keep your immune system strong so you don't get the disease and you don't end up needing a
That's right.
ventilator or, you know, IV antibiotics in the hospital and all that. So, you know, one other aspect of COVID that I think is kind of sad is a lot of times, because of, you know, all the gear the nurses have to put on and stuff, so the patients can actually feel very, very lonely. And you mentioned kind of the mental attitude. And so that's also a tough part of, you know, when you're in the hospital with COVID and you're, you know, the patient gets put in isolation. You know, I think that can be a barrier, and, you know, loneliness and just feeling isolated. And so, so these are some great things to do. And of course, if you do get COVID, obviously the first line is just isolate yourself, and then, you know, hopefully wait it out. But as you're waiting it out, I think these things can help you shorten that time period for the majority of people, where you won't need any significant medical care.
That's right.
So awesome, Magda. Well, again, hey, thank you so much for coming on. And for those, one more time, we got this class December 6th at 2 p.m. at Sandpoint Seventh-day Adventist Church there on Pine Street. And your personal contact info, this is Magda's Medical Massage, 208-907-1517. So 208-907-1517, or look up on Facebook, Chatting Lifestyle with Magda. Did I get that correct?
Yes.
All right, Magda.
Yes, thank you for having me on your show, and I'm looking forward to the seminar on the 6th.
Sounds great. Thank you again for being with us.
Thank you.